we're involved mostly in the monitoring of patients, and we do tests to help the doctors to make a diagnosis. But with regards to COVID-19, our role is basically to help the doctor to monitor patients diagnosed with COVID-19. The testing that we do for the COVID-19 patients are the liver function tests, the complete blood count, the kidney function tests, urine analysis, sputum cultures and blood cultures, as well as HIV testing. So those are the tests, or the support tests that we need to do when it comes to managing patients diagnosed with COVID-19. With regards to COVID-19, patients who contract the virus have complications or consequences of the virus. So the virus, it depends on the patient's comorbidities. So a lot of the times, because these patients are either diabetic or hypertensive, or they may be obese, or they may have other conditions that predispose them to these complications. So they will have their liver function being affected. And when their liver function is affected, they will develop complications that cause them to have clotting disorders. What happens is that the patients will develop clots within the system. And so when that happens, it can cause like what we call thrombus being formed, and will affect the circulation or the function of the lungs. And that's going to cause a further complication to the patient and will make them deteriorate, and adding to the risk of death. It's the complications of the virus that kills the persons. So for example, the clotting disorder, we will do the prothrombin time, or the PT-INR and the PTT, to help the doctors. There's also a test that's done called the D-dimer test that also helps them to determine if these patients are developing any clotting defects that requires intervention. In addition to that, they would need to monitor the patient's white cell count, because oftentimes they have a bacterial pneumonia that accompanies the COVID-19, and by monitoring the white cell count using the complete blood count test that we do here, they're able to determine if this patient is developing a co-infection with a bacteria, or they will also do a blood culture or a sputum culture to determine if they have a co-infection with a bacterial pneumonia. So those are the tests that we help them to do here, to help them to sort of make the treatment more individualized for the patient. Again, it's not one standard thing that's going to happen across the board, so you can know for sure. But by doing certain things, certain tests, if they're going in a specific direction, if they're elevating, you're able to know early and to take precautions. I would encourage persons who feel that they're ill and they may have COVID-19, that they should have the test, because by knowing, you know that there are additional precautions that you need to take. You can prevent your relatives or your friends from becoming infected if you know that you have it. So you take the precautions, you take the isolation requirements.